Good morning and thank you for joining us. Today I'll start off with something that's not COVID. While our local data for COVID-19 is going in a good direction, I am concerned about the number of emergency department visits and emergency department services, emergency medical services calls in our community due to substance use, specifically opioids. I want to speak to this morning about substance use in our region. As you know, the Windsor-Essex County Health Unit is a partner organization for the Windsor-Essex Community Opioids and Substance Strategy. On Thursday, July 15th, the VCOS issued another public alert due to a high number of opioid-related emergency department visits and EMS calls, inclusively between July 6th and July 17th of 2021. Over this time period, the Windsor-Essex County Health Unit's surveillance and monitoring system identified that there were 26 opioid-related emergency department visits. Out of these, 18 of them were overdoses, majority of them involving fentanyl, and of the remaining 8, that was non-overdose related opioid visits to the emergency department, all involving fentanyl. Additionally, we had 8 non-overdose methamphetamine emergency department visits during the same time period. Just to put a perspective, in previous years, our numbers for this week, which is week 27, have been historically low, and the numbers reported by the hospital for this week in 2021 exceed our expected thresholds. In 2022, there were 3 community alerts that was issued as a result of opioid and substance use notification system, while in 2021, or this year, there have been already 9 alerts issued in the first half of this year. These numbers represent people, families, friends, and loved ones that are greatly impacted by the harmful effects of opioid. The impacts of pandemic are challenging on all of us, but for people who use substance, these challenges have been magnified and it continues to affect them in a much bigger way. While the VCOS and the partner agencies involved have been working tirelessly to support people who use substance, it takes a collective community approach to impact the changes that are needed to help save lives. Please go to our website vcos.ca, WECOSS.ca, for a list of local treatment and harm reduction programs and services available in Windsor-Essex County. Remember that you are not alone and help is available for those who are ready. And if you are someone who you care about, but you're not necessarily using opioids on your own, it is important to carry a naloxone kit for the people who you know and who you care about use opioid. Naloxone is a drug that can temporarily reverse the effects of an opioid overdose. And to learn more where to access a free naloxone kit and how to administer naloxone, please go to our website vcos.ca. Opioid overdoses are preventable, and if you are not ready, or if the individual is not ready to quit the addiction, there are other harm reduction strategies that they can use. And if you are using opioids in any form, we encourage you to follow these harm reduction tips. Try to use a buddy system whenever possible while adhering to COVID-19 restrictions and public health guidelines, and use with or in the presence of another trusted person that can help you if you overdose. Always start with low doses and go slow. Avoid mixing multiple drugs or mixing drugs with alcohol. If you mix, try to use less amount of each substance. Always carry naloxone and know how to use it. Positive Pathways Community Services, in partnership with local agencies involved in VCOS, has recently launched a 10-week awareness campaign to bring attention to the opioid substance and overdose crisis. The goal of this campaign is to increase awareness about substance use stigma and to humanize the opioid substance crisis in our community. This crisis has been affecting our community for some time, and it's increasing rapidly locally as we continue to issue these alerts. And because of the tremendous loss that our community has experienced as a result of this pandemic, the Opioid and Overdose Awareness Campaign also seeks to acknowledge and support those experiencing grief and loss. Over the course of this summer, Positive Pathways will be working with community partners in the Windsor-Essex County to facilitate a variety of campaign activities and events to share information and resources about opioid, substance, and overdose crisis. For more information about the campaign and how you can participate in the event activities taking place this summer, please visit www.labelmeperson.com. I'll now switch to our weekly opioid summary, weekly epidemiological summary. So we are reporting 2 new cases today, but due to the routine data cleanup, a net increase of 0 cases was observed. Of the 2 new cases, one is community acquired and the other is still currently under investigation. Right now in Windsor-Essex, we have 21 cases that are active. 6 of them are variants of concerns and 15 are non-variants of concerns. We are not reporting any new deaths today. We have 3 cases that are hospitalized with COVID diagnosis, and 1 of these cases is in the ICU. There are no active outbreaks in Windsor-Essex. So looking into what's happening around the world in Ontario and Windsor-Essex, this is the picture what it looks like from selected countries in the world. And while the cases in the UK are increasing, we are starting to see an increase in the case counts in US and France, and cases in Canada continue to decrease and remain low. We know that UK is at least 4 to 6 weeks ahead of us in terms of what these restrictions are and where they are with everything. They have eased off many of these restrictions, and as a result, they're seeing a surge in the case, which is very, very clear in when you're comparing it with the rest of the world. And most of these cases are happening among those who are unvaccinated. Similarly, we are starting to see an uptick in the cases in the US, and again, mainly in the population that are unvaccinated. It is important that we continue to monitor and learn from these countries that how we do not make the same mistakes some of these countries are making in terms of easing off these restrictions too quickly or not paying attention to the public health measures. When you're looking at, so these are the number of cases, is there any real impact in terms of the hospitalization of these cases? And as we can see, the UK has already starting to see an increase in the number of hospitalization. The curve is going up. And then followed by US, we can see that the cases in the US are also increasing. In Canada, it continues to go in a declining pattern. But again, it's just a reminder that how quickly things can change. And despite all of these measures, if measures are loosened or restrictions are removed very quickly, there is this potential, and just the overall benefit of the vaccination. So we have to look at what these vaccination is resulting in and helping people, because most of these cases are happening in individuals that are unvaccinated at this time. So now focusing just on the Ontario, we are on the continuing trajectory downwards with number of cases, and we can say safely that the 3rd wave is over now, and with the case rates declining everywhere in the province, our region is also seeing the similar picture that we have a continued decrease in the cases in the past week. Our current levels are lower than what we have seen since the beginning of this pandemic. So this is something that is really happened because of the great work of the community and everyone getting their vaccinated and following these public health measures. Our current 7-day average is 1.9 cases per day, and this is the lowest we have seen since the beginning of the pandemic. So this slide, again, bringing those 2 pictures together, what is happening in the province, what is happening in Windsor-Essex, and while the overall trajectory is the same, it's declining, the effect in Windsor-Essex is much more pronounced than the what's happening in the province. So this slide captures the week-over-week incidence rate per 100,000 population from week 17 of 2020 to our current completed week, which is week 27, 2021. And our most recent completed week's case rate is 3.2 cases per 100,000 population. This is also a decrease from the last week. And looking at the past 7 days, so just the 7 days, our rate continues to be at 3.2 cases per 100,000 population, and this is also a decrease from the last week. And just, I would remind that this is, again, the lowest weekly and 7-day rate we have seen since the beginning of this pandemic. So comparing our rates with the province as well as for the southwestern Ontario, our rate continues to stay low. Overall, the cases are declining everywhere, but Windsor-Essex continues to have a much more pronounced effect with respect to these cases, and we're doing much better than the province as well as in the southwestern region. So now comparing all these data with what we are seeing in this wastewater surveillance data. And that is an indicator which tells us sometime with the cases that we are seeing in the community, and if those are the true cases or if we are missing any of these cases. Despite the fact that this is still an experimental tool that we are using, but we have seen very good correlation in terms of the wastewater data with the active cases in our community. So right now what we are looking is it aligns very well with our cases, and we are not seeing any increase in the wastewater data about the SARS-CoV-2 virus. So it truly is painting a picture about our community that the cases that we are seeing, those are the true cases, and with the active cases declining in our community, we are in a much better shape. And again, I would remind and just tell people that it happened mainly because of two reasons: people following the public health direction, and secondly, people getting the vaccine. And that's why we are here in this position with the cases decreasing overall. So with respect to the person positivity by week over week in all the tests, what we are seeing is also a decline in the person positivity data. So our week ending on July 10th, our person positivity was at 0.6%, and this is lower from the last week, and it is the lowest person positivity since late September 2020. So we have come across that hurdle where we have seen the increased person positivity, and now it's also declining as well. Looking at just the most recent 7 days worth of data, and again, this is all preliminary and subject to change, but what we are seeing in the Windsor-Essex, it's pretty much in the middle of the pack with respect to the person positivity data in Ontario, and we are below the provincial average with respect to the person positivity data. Breaking it down further with respect to person positivity data in different age group, it is pretty consistent with no real difference in each of these population group with respect to person positivity. Looking at our overall cumulative regional and provincial rate, we continue to be at the number 4 with respect to high case rates, and it is something that we have seen, and partially because of our high case rates last year and early this year, which led us to be in that position. Looking at more at the municipal level, starting from July to present, so this is just the 2 weeks worth of data. Majority of the cases are coming from the city of Windsor, followed by Kingsville, and then the rest of the municipality to come see Leamington, LaSalle, and Lakeshore, while some of these communities, Amherstburg and Essex, are not reporting any new cases in the last few weeks. With respect to last 30 days and where these cases are, the distribution of these cases, not necessarily just the case rates, majority up to almost 70% coming from the city of Windsor, while the rest of the municipalities have fairly similar data across, with one municipality not reporting any data at all. In the last 7 days, same picture. And then with respect to who's affected most by the COVID now in Windsor-Essex, these are the individuals that are between the ages of 20 to 40, more pronounced in between the 20 to 29 age band, and that continues to be the reason because of the lowest low vaccination rate among this age group. From an exposure perspective, this is what it looks like. From a majority of these cases, as you can see in the red, are coming from the community transmission. So basically it means that the people do not know, are not aware of coming in contact with a COVID positive patient and still contracted the disease. So this is something that we all have to be mindful of as things are opening, that you can contract COVID without even knowing about your risk and your potential exposure. So always take the precaution that you must take, especially with respect to physical distancing. And as things are opening up, as things are more, you are allowed to do more social gatherings with other people, please be mindful of who you are connecting with and ensuring that you have that open and honest dialogue with all of the people that you are connecting with about their status, about their if they are feeling well or not. With respect to source of acquisition, I already touched on that. Half of these cases are coming from the community. And with respect to percentage of daily VOC cases, and you can see a huge fluctuation in that. And the reason for this huge fluctuation is we're looking at the proportion of these cases and how much of them are VOC. But if you have a low case count, this really fluctuates a lot. Sometimes you can see 0, the other day you can see 100%, the other day you can see 50% or 60%, depending on the number of cases. So that's why this may not be as accurate and reflective of the true situation in our community, but all I can tell you, as I mentioned, we still have 6 VOC positive cases in our community that are currently active. Looking at our hospitalization data across the province and locally, both are declining. Looking at the ICU data, similar picture, they're both declining. Looking at our case doubling time, day over day comparison, we continue to have a high case doubling time. And just as a context, having a high doubling time means we are doing better. So looking at the data from Windsor-Essex, Canada, Ontario, the case doubling time is increasing everywhere, but it's much more pronounced in Windsor-Essex compared to Ontario and Canada. With respect to mean R not effective, we are currently at 0.99, and so in some way this is higher than where we were before, but with the low numbers, with the low cases, the R naught fluctuates quite a lot, and because of the high variability with low case rates, it would be very difficult to assess a true picture based on just the R naught of what is happening. Obviously, it continues to be lower than 1, which is great, because having an R naught of less than 1 means that the cases continue to decline in our community. Now, switching gear with respect to vaccination, as we continue to report, Canada has one of the highest vaccination rates in the world now for people who have received at least 1 dose of COVID-19 vaccine. And even though we are seeing some decline in the new uptake of COVID-19 vaccine, but overall, we still are one of the leading nations in the world when it comes to COVID-19 vaccine. With respect to people who are fully vaccinated, not just with 1 vaccine, Canada continues to improve and is among the top countries with the vaccination. We just recently surpassed data we have exceeded Germany last week, and we are on track to surpass the US vaccination rate in the next few days for people who are fully vaccinated. So we will be in a much better spot, and we would like people to continue to get the vaccine so we can open up safely, we can continue to do well economically, financially, socially, and keep everyone safe. So a very good reminder in terms of where we are and how things are evolving in our communities. So looking at the number of first dose versus second dose administered, as we can see, the second doses are in light green, while the first doses are in the blue. And the majority of the cases, majority of the vaccine that we are administering right now, especially from middle of May and leading into June and pretty much all of June, the majority of the vaccines that are being administered is the second dose. Looking at the data with respect to our moving average, whether we are doing better or worse with the day-to-day vaccination rate, so we are seeing some fluctuation. There are some days when there is low vaccination, and partly because of the days when the vaccine clinics are not operational, but majority of the vaccination sites are operating pretty much at least 6 days a week. And with the high availability of the appointments and everything, we are still seeing some availability, and there is obviously, if you're looking for vaccine, you can get the vaccine through walk-in. You can book your appointment and get your vaccine as soon as possible. With respect to the first and second doses, this is what it looks like. The first doses are still getting somewhere around 9 to 10% every day, while the second doses continue to fluctuate anywhere between 80 to 90% in our community of all the vaccines that are being administered. So looking at the cumulative doses, and as we can see that the second dose is rapidly increased with respect to the availability of the vaccine and the availability of the appointment. From a coverage perspective by age group, our coverage is 64.9% or 65% if you want to call it. And when we are looking at the individuals that are 18 plus, that's 75.9% of our individuals are currently vaccinated with at least one dose. And if we look at 12 plus, that number is 73.9%. So we are closing that gap between 12 plus to 18 plus as well. While the other part is we are also seeing a huge variation in terms of the first dose coverage among different age band. The older age bands have a much higher coverage rate compared to the lower age band, and that's why we are seeing some of these cases among the young adults, as I mentioned in my previous graph, 20 to 29 and 30 to 39. Those are the two important age band that are seeing the highest number of cases of COVID in our community. So this graph shows the uptake of first dose vaccine among different age group, and we can see that we are starting to see some increase in the uptake between 12 to 17, which is very critical because we definitely want to make sure that we are providing a safe learning environment for our children who will go back to school in September. And if they're vaccinated, they will be protected. They will do their part in reducing the transmission of COVID-19 in the school and help to keep the school open. With respect to Windsor-Essex that are fully vaccinated, similar picture, overall 50.8%, 12 plus 57.8%, and 18 plus it's 60.9%, which is pretty good. But obviously, on the flip side, you still have almost 40% of the people that are not fully vaccinated, and that constitute roughly around 80,000 people in our region, 80 to 90,000 people in our region, which is pretty significant when it comes to the disease transmission. So while it's a good news, we still have lots of room for improvement. So in terms of the age distribution with respect to all of these vaccines, we are starting to see, we continue to see that the second dose is increasing in all of these age band, and in some age band, it's plateauing at this time. So looking at the first and second dose coverage rate, this is a new graph that we are putting in. It basically shows the coverage rate by age group in Windsor-Essex, and again, first and second doses. So pretty much it looks similar with respect to the coverage, but obviously we still have lots of people who need to get their second dose to be fully protect themselves and keep our community safe. When it comes to hotspot with at least one dose administered, and again, this includes all the residents, including children, and the majority of these children are not yet eligible to receive the vaccine. Our overall coverage in the community, including all residents and children, is 64.9 or 65%, but in the hotspot, it's slightly lower, which is close to 59%. And we can see the variation between some of these hotspots, with some hotspot having coverage well below what the overall coverage looks like. And similar picture with the second doses, and across some of the same hotspot FSAs that has lower first dose vaccination coverage. They similarly have a lower second dose vaccination coverage as well. And working with all our community with the high priority partnership, there are a number of pop-up clinics that are being offered in these neighborhoods. There are a number of activities that we are doing with the school boards to engage the families, the children, to get the vaccine. There will continue to be lots of effort in the coming weeks and in the coming months to increase the vaccination rates in these hotspot communities. With respect to the vaccine, obviously Pfizer-BioNTech is the vaccine that has been mostly distributed in our community, followed by Moderna and AstraZeneca. Right now, what we are seeing is we are giving out quite a bit of Moderna and Pfizer vaccine in our clinics based on the availability of the vaccine. When it comes to so this graph basically shows that as the vaccination rate increased in our community, our cases continued to decline in our regions. Comparing ourselves with where we are with at least one dose by public health unit, and so we are doing well locally, but obviously there's a lot of room for improvement. We still haven't captured all these individuals who got their 2 doses of vaccine, or at least 1 dose of vaccine in the United States. We are in the process of collecting that information, and we are encouraging anyone who has received vaccine out of province to log on to our website and register their information. That would be, then they will be, that information will be put in the provincial database. That would help us to get a better sense of where these people are and what's the true coverage rate. I truly anticipate that we at least have 2 to 3 percentage points more than what we have right now with respect to all those people who received their vaccine in US. Similar picture with the full 2 doses, and among some of the larger health unit, we are pretty much at the top with respect to individuals that are fully vaccinated here. So in summary, the case rates in Windsor-Essex have decreased again this week, and now presenting some of the lowest case rates throughout the pandemic. COVID-19 related hospitalization and ICU continues to remain low. Wastewater surveillance data aligns very well with how the cases are in our community. Our first dose vaccination coverage rate is 65.1%, which is again a slight increase from last week, which is at 64%. Our second dose vaccination coverage is also at 51.6%, and this was increased from 44.4% last week. With respect to the monitoring indicators, our most recent completed weekly case rate is at 3.2 cases per 100,000 population, and our most recent 7-day, which is pretty much the same as well. Our percent positivity continues to be 0.6% for the full week, and the most recent 7 days percent positivity is 0.8%, minor change, but overall still in the same line. R naught effective is 0.99, but R naught, as I mentioned, with low cases, it is not as stable as it would like to see, so we'll see a lot of fluctuation with R naught number because of the low case count, but overall we continue to have an R naught which is less than 1, showing that there's an ongoing decrease in the cases in the community. There are no current active outbreaks in Windsor-Essex, and at least 76% of, almost 76% of Windsor-Essex adults have received at least 1 dose, and almost 61% of Windsor-Essex adults are fully vaccinated. Thank you. That was a long one.
We'll now take questions from the media. Today we'll start with the Windsor Star.
Good morning, Doctor. On the opioid-related emergency department visit topic, do you have an update on the public input survey for the consumption and treatment services locations?
So that work is still ongoing. The survey is still open, and we will be analyzing that data, and we'll share that information publicly, but I don't have anything more to share at this time.
Okay, and then separately, is what we're seeing in the US and the UK in terms of an uptick in cases and hospitalizations, is that foreshadowing what is to come for Canada, or will our higher vaccine coverage rate make enough of a difference to prevent that surge? So
truly speaking, I feel that because of, so there are a few information that I think maybe people will find it, will interpret it differently. We have a very high vaccination rate, which is great, which is definitely something that we need, and it will help us to not to see the same impact that is being seen in UK and US. So that's one thing. But the second thing, when people look at these high vaccination rate and low case rates, they may feel that I don't need the vaccine because COVID, like I don't have cases in my community, our case rates are really, really low. Why do I need the vaccine? And I don't want to get the vaccine. That is the danger. And even though in terms of percentages, we can talk about, yes, it makes sense, 75% of the population coverage, great. But on the flip side, 25% of the people who are still unvaccinated, what about those? So 25% of our people constitute almost 100,000 people in Windsor-Essex. And if you have 100,000 people in Windsor-Essex that are vulnerable, that can contract COVID, and if and when it starts to increase, the virus will have lots of hosts that would be unprotected who do not have any immunity. And then we will see those cases. So while there are some lessons that we can learn from UK and US, and clearly all the data that is pointing out that the cases that they are seeing in US and UK are, majority of the people are in unvaccinated group. We know Delta, when you're fully vaccinated with 2 doses, it will protect you. But for people who are not fully vaccinated or people who haven't received any vaccination, they will continue to be vulnerable. So really, there is a good lesson that we have right in front of us to see the benefit of the vaccine, that the vaccines are clearly preventing many of these cases. And we are at a better spot because of the vaccination, but it's not the time to ignore the fact that we still have a large number of people who require vaccination in order to prevent anything further in the fall, because otherwise we will go into the same trajectory where UK and US is going, with cases increasing in the unvaccinated population, leading to more pressure in the system, leading to more concerns, more ongoing spread, people dying, and would require some more restrictions, which none of us want. So this is the time, take the opportunity, get the vaccine, be prepared what to come, and prevent this from happening in the first place, just like we did for the third wave. So now we have an additional tool in our arsenal. We have the vaccine. We avoided third wave when the entire province was experiencing a significant third wave, all because we followed the public health measures. Now, one of the important tools that we have is the vaccine. We can avoid any further wave if we continue to vaccinate our people, continue to follow the guidelines, and we will be in a better place. And I truly request everyone, please get the vaccine.
Thank you.
Any questions from AM 800?
Dr. Ahmed, just in regards to the overdoses, I'm not even sure if you can get into this, but are these repeat individuals that are going to the emergency room?
So good question, Rob. Sometimes it's hard, especially in the beginning, to tie up and see if these are the same people. Anecdotally, I can say, yeah, majority of them are the same people who we are seeing, and but I can't say what proportion. And when we're talking about the alert system basically identifies who's there. And it could be the same individual who was there maybe a week ago. It cannot differentiate that unless we get to the individual case level data, which is hard when you're talking about a surveillance system. But overall, definitely we try to see how many new cases of opioid related overdoses that we see in our community. And some of that data we try to present in our annual report related to opioid morbidity and mortality.
I know we asked you this question before when alerts were sent out this year, but I guess with the increased alerts with the increased alerts being sent out, I guess how worried, concerned? It just seems like it's a very scary time right now.
It is, and it is a scary time for many people. And as I continue to highlight that, the pandemic is impacting everyone. There are many reasons for people to feel stressed, people to feel anxious, people to get stressed about so many things in life. And for people who have a mental health history, people who have a history of addiction, they are even more vulnerable. And they end up in using some of these substances to control some of their concerns, fear, stress, and anxiety. And then if they are not doing it safely, they are putting themselves at risk. And we as a community, I think we really have to address all of this, when we're looking at the impacts of pandemic, while we're looking at where our efforts need to be, we come together as a community to fight with COVID. Now is the time that we also need to come together as a community to fight against the opioid epidemic here in Windsor-Essex and across the country. We need to be together. We need to get the word out. We need to educate. We need to make sure that we are supporting people who need our support. We are working with many, many partners to get the right support in place to support these individuals, but it will take a collective community effort to make sure that we are doing something, we are saving these lives, we are putting them in the right path of recovery, and then take away from their path of addiction and then further overdoses, put them in the recovery path, make them useful and for our community.
And one final question, just in regards to vaccinations. I know the health unit sent out the release earlier this week in regards to the mixing of the different kinds. When individuals, and we asked Teresa this question before, but when individuals go to the mass vaccination site, as the individuals walk out, if they didn't receive, I guess, Pfizer or Moderna the first time, but they were offered a different one the second time?
We are seeing some people walking out, which is really, really unfortunate. We live in a country where we have plenty of vaccine at this time right now. There are countries who do not even have access to any vaccine, let alone, which vaccines are better, which vaccines are safer, let alone some countries do not even have access to vaccine. In many of these countries, people are dying because they don't have access to healthcare either. So we are lucky, we are blessed to live in a country where we have plenty of vaccines right now. And it is unfortunate that some of these messaging, sometimes when it comes out, it creates doubt in people's mind. And as we have said, that along with many, many experts, that mixing and matching of these vaccines are safe, based on number of research and also based on the expert opinions of everyone who's involved in the vaccination program for a number of years. The comment that was circulated by World Health Organization is completely taken out of the context, because this was not the intent of that. It was to target those people who are living in a country where you do not have that much control over who is getting the vaccine, where you're getting the vaccine, and what kind of database are in place. So this was to touch on those people who are doing the vaccine shopping on their own fruition rather than having been directed by any public health authorities. So it was for them that you have to follow some of these public health guidelines that exist in the country. So the comment from World Health Organization was taken completely out of context, and we continue to say that these vaccines, what we are offering, continues to be a safer option to provide the level of protection that we need. There are thousands and thousands of people that have received the mixed doses of the vaccine. I don't have the exact number. I think provincially or federally, we probably would have been in like hundreds and hundreds of thousands of doses that was administered using the two different versions of the mRNA vaccine, or receiving an mRNA vaccine after the AstraZeneca vaccine. So there are a number of people who have already gone through and are doing okay. There is no concern. There is no safety concern. There's been data from other parts of the world that has shown the effectiveness. So while, again, it is important that everyone needs to get the vaccine, and we continue to say, when we have the vaccine, yes, there is plenty of reason for people to be offered which vaccine you want. But right now, it's the timing is critical. If you want to get ahead of this virus, we have to get the vaccine as soon as possible, so we, as a region, as the province, as a country, can move forward.
Thank you.
Any questions from CTV?
Yes, good morning. Your thoughts on the border opening in mid-August and allowing fully vaccinated Americans to cross into Windsor-Essex?
So I think I've said this before, that that's the eventuality that people will travel, people will cross border for reasons that goes beyond the essential reason. So we will be doing the same as a country, it seems like, and as long as we have a good system in place for people who are fully vaccinated to travel, I think we'll have to accept that reality, that this is the reality that we have to live in. But as the community, I think we still have to be careful when we are having these interactions, what kind of risk it will pose to you, and just be careful. I think fully vaccinated, if they do not have any symptoms or anything like that, I think they should be okay to connect with them, just like we are opening it up because most of us are vaccinated right now. So when travelers are coming in that are fully vaccinated, the risk would be low. But again, there is no risk-free option. There is no zero-risk option.
Are you at all concerned, or do you think it's too early? I mean, mid-August. Do you think it should be pushed back a bit as the numbers are increasing in the U.S.?
Well, I think it really depends on a good system in place to validate the information for people who are fully vaccinated, because even if you have some states that are seeing a higher cases, we know that these cases are typically happening in people who are unvaccinated. So people who are fully vaccinated, as long as we have a good system in place to confirm the validity of their record, I think that can still happen. Okay, and also your thoughts on the vaccine passport, now that Ford has said it's not happening in Ontario. What are your thoughts? Well, I think this is something that we really have to talk about, that what kind of impact it would have in the province or in the country, and if it's a good thing to move forward or not. We know that, again, we live in a world where there is many type of connections and interactions that are happening, and having good control measures in place that prevents the spread of COVID-19. I think we have to look at all of these measures, and we have to have an open and honest dialogue about it, that if this is something that we all agree to. We have more than 75% of the people who are vaccinated, and we really have to think about what are we trying to do, who are we protecting, and what kind of an impact it would happen if the cases starts to increase, especially among the unvaccinated people, and then would it result in further, let's say, restrictions or closures, or maybe limited activities or limited opportunities for people to do things that they want. So we have to have that open and honest dialogue at all levels to figure out what is best for our community, what is best for our province, what is best for Canada. I truly feel that we have made many, many sacrifices. Everyone has made many, many sacrifices, and we definitely don't want to lose all the success that we have built so far in fighting off COVID. We need to have good systems in place to ensure the safety and well-being of everyone.
Okay, and just one last question. Do you have any updates on the campaigns in the hotspot areas in our region?
So can you repeat your question again? I didn't get it properly.
Oh, just an update on how the vaccination efforts are going, the campaigns that are happening in the hotspot areas where there's a low vaccination rate across Windsor-Essex.
So some of the mobile clinics that we had that was held, it didn't brought in the traffic that we were expecting to bring. And I think that has been the case that we have shared in the past as well. It's not the availability of the vaccine that is an issue. It's more about the engagement effort, and that engagement needs time. That engagement needs to make sure that we have the right partners at the table, people who are well connected within these communities to understand and address their concerns. A lot of the work is happening through those organizations. A lot of the work is happening through the school boards as well, to engage them and especially the vulnerable families, where we can continue to remove some of these barriers to vaccination. So we will continue to do that work, but again, it will take some time. That effort is ongoing. I think with some of the campaign that was just targeting not only the hotspot, but maybe more broadly about the 12 to 17 age band, we're starting to see some increase in the vaccine uptake. But again, this is an early increase. We'd like to see it more. As I continue to mention, we want to make sure that these children can go back to school and have classes in person. It is absolutely critical that they continue to learn. They continue to compensate for the time lost last year because of the pandemic. And the best protection that they can get right now is to get the vaccine. So when schools open, they can stay in school without the need for closing the school or dismissing a cohort and disrupting the education again. So as a children, if they are eligible to get the vaccine, please get them vaccinated so we can provide them the safe learning environment. So that campaign is also going well. And overall, I think we'll continue to work. It will take some time. The next 10% won't come that quickly as we like to see. But our team, our partners, Windsor Regional Hospital, our CMHA, many other partners, Erie Shores Healthcare, EMS, everyone is working to make sure that we continue to move forward as a community. We have one of the lowest COVID-19 case rates throughout this pandemic right now. Let's just build on that. Let's just continue to do the good work that all of us are doing. And a lot of that credit goes to the vaccine, and we want to make sure that everyone gets vaccinated.
Perfect, thank you.
Any questions from CBC?
Yes, good morning. One of my colleagues noticed that the rate of first vaccination seems to have come up slightly lately, stabilizing at around 500 a day. First of all, is that encouraging? And second of all, is that related to the increase among school-aged children?
So when we are reporting 75%, yes, so that's the adults, but yeah, so sorry. The first dose vaccination, yes, that has come up, and it's partly because of the 12 to 17 years age group as well.
Thank you. And the rate of second vaccination seems to be slowing right now. Are you expecting that to continue, as we get closer to having more people fully vaccinated?
I think that's the harm that I was talking about, that people may get the false impression that, the cases are decreasing, and the sense of urgency to get your vaccine may not be there as it was before. And this is the time, you don't want to get vaccinated when the cases are already spreading, because it's already too late. You want to act before it happens. So there are a couple of reasons why we are seeing that the rate is decreasing even for the second dose is first of all some confusion about the mixing of these vaccines, and we have been very clear in terms of what it means, and some of the confusing messaging, unfortunately, it's coming from people some of these messaging are coming from the comments that are sometimes it's out of context and doesn't necessarily reflect the true understanding and the true messaging that we are trying to give. So the mixing is something that is lowering the second dose uptake, and also the comfort and the lack of sense of urgency to get the second doses. And hopefully that we will overcome that. We know that there are more vaccines coming in to Canada. We have seen a decline in the Pfizer vaccine. We hope to see that number will increase again, and we should be able to, we want to be in a position where we can vaccinate people as quickly as possible.
Aside from the concern over vaccine mixing, are there also concerns about people not coming back for their second dose at all?
Well, that's exactly what I touched on, is the sense of urgency may not be there, and they may feel that while they got their first dose and the cases are not in the community, and as a result, they may not feel the need to get the second dose. And it is not true. You still need to get the second dose, especially when you're talking about the Delta variant, you need to be fully vaccinated to feel protected from the Delta variant. And also, even for any other type of variants, we know that the vaccines are effective in reducing these case rates everywhere in the world. We have the opportunity, and despite those people who may not feel the same sense of urgency or same risk, but the risk continues to exist, and you need to get your second dose as well to complete the series.
Thanks very much.
Any questions from CFTV?
Hello?
Any questions from CFTV?
Yes, good morning, Dr. Ahmed. I have a quick question for you. I'm wondering if vaccinations will be mandatory in all the schools come the fall.
So at this time, I have no indication that it will be mandatory. It will have to wait to hear from the province. But at this time, I don't have any indication that it would be mandatory. But I strongly urge parents to get their children vaccinated to make sure that there is no interruption in their education system. We know that how important it is for people for children to stay in school. Any kind of outbreak, any kind of disruption in the system would be devastating for them. So right now, I'm not anticipating that it would be mandatory. It could change, but at this time, I don't have any indication that it would be mandatory. It would be voluntarily, but I would request parents to get their children vaccinated if they're eligible.
Well, there's been some discussion regarding masks in the school system amongst parents, and some parents are saying, oh, well, if your child has been vaccinated, they won't have to wear a mask, but the unvaccinated child will. And I'm thinking that if they don't make this shot a mandatory thing, you're going to have a lot of kids in there that are not going to be protected. You know, and this is what parents are worried about. They're saying, you know, if I'm going to get my child vaccinated and then come into school, you know, and there's kids in there that aren't vaccinated, my child can pass it on to them just through carrying it. So parents are really talking, and I'm hoping to get some sort of your viewpoint on the whole subject.
Well, it is challenging. There is an Immunization of School Peoples Act, which is a provincial regulation, and it does identify the list of vaccine and the conditions that requires people to get the vaccine. We obviously don't want to use a strict tool to force people to do the things that they need to do, but it does create this perception that one is safer, and the blame could happen because of the unvaccinated people versus the vaccinated people and whatnot. And sometimes we don't even know that what is the reason for these people not to get the vaccine. There are very few medical contraindications for the vaccine, which I get it, but then there are other choices that we are talking about. So while it is important that, as I request that everyone to get the vaccine, if the parents feel that this is what they need to do to have be part of the ISPA or something, I think they have to communicate that to the school boards. They have to communicate it to their MPPs, to pass it on to the provincial governments, where the relevant legislation lies with the provincial government, and any action that could happen, it would be through them. And but locally, we would continue to encourage people to get the vaccine, because it is important for all of us to get the vaccine as quickly as possible.
Thank you very much.
Any questions from Blackburn?
Yes, good morning. Most of the questions have been answered, but the city of Windsor has announced that the WSU Center will be turned back over to them by July 31st. I'm just wondering if there's a date for the Libro Center and the Nature Fish Farm Center.
Yeah, great question, Maureen. So we are in conversation with our county counterparts to have a discussion on that matter, and to see what kind of volume or traffic we are seeing in those places and the demand for these vaccines. If the demand continues to decrease, and can we accommodate those demand through the existing system, which is the pharmacies and the primary care providers in all of these regions? If it's possible to shift all these demand to all the other providers, we will move in that direction. But this is a conversation that is happening right now. I don't have a set date in my mind to say that when they will close, but it may happen as early as in August, sometime in August. But we may need to keep one site in the county maybe for a longer period of time. And among all that, the other thing that we are also thinking about is the potential vaccine for children who are under the age of 12, when that would come. So we'll have to be prepared for that as well. So there's a number of issues that we are trying to deal with. With Sears opening or the mall site, we have plenty of capacity, but it's just one location, and we have many satellite locations in the pharmacies and the primary care providers, which we like to increase further. So we want to reduce all those barriers. We don't want people to go through all of this to get the vaccine, and if they can get the vaccine through their neighborhood pharmacy, through their primary care provider, they should be able to get it. So a lot of work is happening, but hopefully we'll start to reduce the number of mass vaccination sites, because these are resource intensive. It takes a lot of money, a lot of people to operate those sites. And if we don't need them, we will shut them down.
Thank you.
Any additional questions from the Windsor Star?
Yes, doctor, on the topic of mass vaccination clinics, you've been for a few days now offering vaccines on a walk-in basis there, something that hasn't been done before. Do you know how long that will last and how vaccine supply is accommodating that?
So right now we have plenty of vaccine, and I think it's just the if people are choosing the vaccine, that's a hard one, because we don't have the luxury to choose the vaccine at this time. Maybe in the future we will have that luxury again, but right now we don't have the luxury of choosing or giving you the option of which vaccines you're getting. mRNA vaccine, they are the same vaccine. So, and we know, we have heard it from the expert that it's safe. So we hope that we continue to offer these walk-in, especially for the first doses, because we want to encourage people to get the first dose. And then obviously when they get the first dose, they will get the second dose. And there are a number of people that are already booked for the second dose, and appointments open up every day. Sometimes you call and then you can make an arrangement to go and get your shot the same day as well. So I hope that with the vaccine that will be coming into our region, we should be able to offer the walk-in as well. But walk-in, it may be convenient for people who choose to go. It is also a resource-intensive process for the sites, if to register someone and put all the information. They are doing that right now, but hopefully that people take that opportunity to book in advance. If not, they can still come in and we'll vaccinate them as much as possible.
Do you know how it's been going so far with the announcement of walk-in availability? Did you see a surge of people showing up, or was it sort of business as usual?
We do see people showing up. I don't have the exact number. I wouldn't say that it's hundreds and hundreds of people that are showing up as walk-in, but we do see people walking in to get the vaccine at all our sites. We have seen some fluctuations. We have seen some walk-in coming to Leamington site. We have seen some walk-in coming to our mall site. Libro is somewhat a little bit in a place where you have to plan to go and get the vaccine. So may not necessarily be the same for Libro. We have seen many people showing up as walk-in at WFCU as well. So we are seeing, but it fluctuates. I wouldn't say it's hundreds and hundreds, but it's a steady pace of walk-in that we are seeing in some of these places.
Thank you.
Any additional questions from AM 800?
No, thank you. Have a great weekend.
Any additional questions from CTV?
No, thank you. Have a good weekend.
Any additional questions from CBC?
Yes, just one more. Henry Ford Healthcare is holding a job fair recruiting local nurses to work in Detroit. So I wanted to ask Does the health unit have enough nurses on staff, or are you aware of any kind of nursing shortage in our region?
Well, I think our complement of staff is pretty good. We hired many nurses as part of the COVID response, and Nicole is not here to talk specifically on the resourcing side, but I think we have plenty of staff available on our at our health unit for the COVID response. I'm not aware of any additional shortage in the community, but I may not be the right person to speak about it. I can talk about the internally that we recruited many nurses to respond to COVID-19, and they continue to work for the health unit at this time.
Thanks very much.
Any additional questions from CFTV?
No, thank you.
Any additional questions from Blackburn?
No, thank you. Have a good weekend.
Thank you, everyone. See you next Friday.
Thank you.